Thank you, Mr. Speaker. Today, one might get the impression that with the media buzz and the attention that this is the session about health care. I was impressed that the governor was here today. I was surprised. He usually gives me some notice that he's coming, but it was good to see him in the area. But I don't think this is the session about health care, and I spared you a 5-minute speech just to say this. I appreciate the hard work that's been done on the two bills that we passed. I understand how important they are to folks. But this is not the session about health care. This is the session about Oregonians hurting, Oregonians without jobs. And I believe we just heaped more trouble on Oregonians without jobs. The argument and the debate would have had a lot more integrity if in this building we had had a serious discussion about tort reform. The argument and the debate for health care reform would have a lot more integrity, in my opinion, if we could plug the holes where small mandates relating to health care go in and out without any possible filter or prevention. And yet, we move ahead with this railroad for health care reform. If you want health care reform, in my opinion, Mr. Speaker, you'll start helping small businesses and families to jobs that pay wages, that pay taxes, and make it possible for them to pay health care premiums. That's where you start. Is it a perfect system? No, we heard that today. But you start with jobs, with people that can afford to take responsibility for their families. You don't start with blinders on about this economy and call it health reform. It's not a pretty system in its underbelly. It's dysfunctional, as members of my party and the other party said. But with its deficiencies, with its dysfunction, with its inability to help those in need at times. The research that we have in the medical field, the health care that we provide, the way that we subsidize the rest of the world with pharmaceutical research and all the rest of it, in my opinion, with its flaws and its warts, still is the best system with the most possibility in the world. Let's get to work on putting Oregonians to work before we call this the health care reform session. Thank you, Mr. Speaker.